Hi everyone, welcome to today's Face Facts by Dr. Yusra. On today's episode, I am sharing with you the top 5 mistakes that I see the most in my clinic and I want you to avoid. These are really, really important and can even be life-saving. Now, before you go further, I'm going to caveat that this is not an advertisement for Botox. Botox is a brand name that is shorthand and often used to describe and explain botulinum toxin. But this one is for anybody having any botulinum toxin injections, how to avoid having bad results, and how to ensure that you get the best results, not just in the now, but for the rest of your life. Hope you enjoy. Hi, everyone. Welcome back to Face Facts podcast by Dr. Yusra. This is the podcast where we talk all about the science behind aesthetic treatments and the wellness industry. I'm Dr. Yusra Al-Mukhtar. I'm an aesthetic practitioner based in the United Kingdom. I have a clinic in London and in Liverpool by the beach. And today we're talking about the 5 most common, biggest mistakes that I see and have seen in 2024 that you need to avoid. Now, whether you're new to Botox or you've been getting it for years, these are common pitfalls and they can really lead to suboptimal results or even worse, really serious complications. And it's really important to understand these mistakes so that you can avoid them. Now, before I go further, I want you to understand that Botox is a brand name. It's commonly used to talk about a neuromodulator or a botulinum toxin type A, which is made by Allergan. People often use the word Botox interchangeably between the different brands. Whilst Botox is a brand name that is patented by Allergan, botulinum toxin is a product which is an active drug, and this can be found in various different types of brands, including Bocature, Xeomin, Azilor, Dysport, and more. So we can use the word Botox interchangeably for the reason of this podcast, as long as you understand that that is a patented name and Botox is a brand name. We'll use it today to talk about botulinum toxin as a shorthand, and botulinum toxin is the drug that is being injected to create a cosmetic effect or a temporary solution to reduce lines and wrinkles of the face. Now, it's a very common cosmetic treatment. It's a treatment that can also be used for medicinal purposes. So sometimes we're using botulinum toxin or Botox for the injection of and the treatment of patients who have grinding muscles known as bruxism, and they end up having enlarged masseter muscles called masseter hypertrophy, which can distort the normal anatomy of the face and also cause worsening of the grinding because they now have a larger, thicker, tougher muscle clenching with the upper jaw against the lower jaw. But in the cosmetic industry, Botox is used for the temporary relief of lines and wrinkles in the face. Now, this is very important that I explain that this podcast is purely for factual information. It is illegal for us to advertise Botox. This is not to advertise Botox or botulinum toxin or any prescription-only medicine. This is a fact. It's called Face Facts. We're talking about facts that you know, the important things before you start to have botulinum toxin injections. So, the 5 top mistakes that I see most common. Number 1 is using too much Botox in the forehead. Now, this is particularly important and worrying in women. So let's talk about the anatomy of the forehead. I'm going to put a little picture here so you can see what the muscles look like. The muscle of the forehead is called the frontalis muscle. There are different types of distribution of the frontalis muscle. There's been 4 key different types of distribution of the muscles. Some people have a complete V-shape missing area in the middle, and some people have it fused, some people have one long sheet. So the types of forehead or frontalis muscle, the distribution of that muscle will differ person to person. But why is it so important that we are not overusing botulinum toxin or Botox in the forehead of women? Well, this is the only muscle that actually lifts the eyebrows. The muscles of the upper face work as antagonists to each other, which means it's a tug of war. You have muscles that pull up and you have muscles that pull down. And most of the muscles of the upper face are pulling down. The only muscle that lifts the eyebrows is the frontalis muscle. And this muscle, it can be separated into thirds, 3 distinct areas, and the upper third has a different function to the lower 2 thirds. The distinction, the line of distinction is known as the line of convergence. This is where the upper third of this muscle actually pulls the hairline down and the lower 2 thirds of the muscle pulls the eyebrow up. Now, often people are having botulinum toxin injections in the frontalis muscle in order to reduce horizontal lines that they're getting when they're looking surprised or when they're lifting their eyebrow. They want to reduce those lines and those wrinkles because they can make them feel or look aged. And they're going for that shiny forehead look. Now, whilst that's all very good and well, it's important to understand that what botulinum toxin does is it stops the nerves from sending a signal to the muscle to contract. So it stops the release of a neurotransmitter called acetylcholine from going from the nerve, sending the signal to the muscle so that the muscle stops contracting. Everything talks to each other. And the way that the muscle contracts is that the nerve sends that signal, or that the release of this acetylcholine neurotransmitter goes from the nerve to the muscle, causing that contraction. So by blocking it, the muscle no longer receives the signal and the muscle no longer contracts. But if this muscle no longer contracts, what that means is you won't be able to lift the eyebrows anymore. And this can result in a heavy brow or a drop brow, which can make you look angry. It can also make you look aged, and it can make you look masculine. So in a female, putting too much botulinum toxin in the forehead muscle can actually do the opposite of what you want, which is it will make you look older, make you look more masculine, and make you look aged. So if you want a lifted brow, it's important to consider doing less or alternatively doing none in this muscle. It becomes even more important as we age, because as we age in all 5 layers of the face. So that means that the skin is changing. We're getting more lines and wrinkles in the skin because of collagen loss, elastin loss, hyaluronic acid loss. We are also getting muscles that start to become thinner and more lax. We also have fat pads that are shrinking, and also the bone is shrinking. And that results in changes in all 5 layers of the face, which leads to the changes that we see when we age. Now, if you think about what's happening as we age in the upper face, what women often tend to see, and also men, but it becomes really problematic for women, is that the eyebrows start to become heavier and they start to get laxity of the brow area, and the skin of the brow area even starts to lean on the upper eyelid. And that is a condition called dermatochalasis. It can really make you look aged, and eventually it can even interfere with vision. And again, this is multimodal in its etiology, which means it's caused by changes in all the layers of the face, including skin laxity, including muscle laxity, including volume loss. So if we are using botulinum toxin in the frontalis and we are stopping the patient from being able to lift the brows, this can be made to look worse. The eyebrow will start to sink, and the upper eyelid area can look heavier, so you look more aged. And often women who are conscious of the fact that they have excess skin in the upper eyelid try and compensate by raising their eyebrows. So I often see this in women aged 55 and above, where they consciously or subconsciously are lifting their eyebrow to compensate for the laxity that they are starting to see due to aging. If you have Botox in the frontalis muscle, so the forehead muscle, to reduce the lines and wrinkles in this area, you will inadvertently stop your ability to lift the eyebrow, which means you're going to have an exacerbation of heaviness of the upper eyelid area. So that is problematic. And then you need to start thinking that the treatments that you're having are leading to a certain destination. So if you're a younger woman who might not have laxity in the upper eyelids, but you're having Botox or botulinum toxin every 3 months or so, what you will inadvertently do is start to cause thinning of that muscle. So that muscle sheet will become thinner and thinner and thinner. It will atrophy, and it will be less able long-term to perform its function, which is to retain the position of the eyebrow. Accordingly, what will then happen is you're going to lose the function of the muscle to keep the eyebrow up. So my advice in a female is less is more, particularly in the forehead muscle, whether you are a younger woman or an older lady who wants to maintain the position of the brows, because you're going to need that brow position as you age. So do not thin that muscle too much. Number 2 most common mistake that I see is doing botulinum toxin of the crow's feet, particularly this lower down injection point, to reduce lines and wrinkles that go across the cheekbone at the same time that you are having cheek filler. Now, why is that a problem? Well, if you think about it, the muscle of the eye area, this is known as the orbicularis oculi muscle. This muscle is a concentric muscle that goes around the eye, and its function is to pump the eye, okay? And it helps with closing and opening the eye. You have levator and depressor muscles of the eyelid, but this function, the muscle function and the activity pumps, is a pumping action, and it helps to aid with lymphatic drainage. So when you use botulinum toxin around the eye area, particularly in the lower lateral canthal area, so the lower crow's feet, you stop the movement and the activity of the muscle. Now, botulinum toxin is an injection that stops muscle movement, whilst filler is a volumizer. It's designed to create structure and volumize, and may be used to improve the position of the cheekbone, or to create a lift, or to replace lost volume that is seen with aging. But if you have filler, you might also have swelling. And if you have botulinum toxin at the same time as having filler, what you might inadvertently cause is swelling buildup, or a buildup of fluid in the area, because you have diminished the ability of the muscle to perform its function, which is partly lymphatic drainage. So separate the two treatments out. Have your botulinum toxin done on a different day than your dermal filler treatment. Doing it at the same time could cause migration of the products and could cause prolonged swelling. And I see this often. And I also see people placing too much toxin lower down, which, because you're stopping the movement of the orbicularis oculi, you can almost get a loss of emotion and expression, and you can get bunching up of the tissues, creating an unnatural smile. When we're smiling, we're not just smiling in our teeth, we are smiling in our eyes. So by placing too much, you are taking away the warmth and the authenticity of the micro expressions of contraction and a smile, which includes contraction of the lateral aspect of the eye. So instead of trying to get a completely frozen look, try and do less so that you maintain your smile. So you're reducing the lines and wrinkles, but you're maintaining a smile. And certainly separate the filler appointments, the cheek filler appointments, from the filler appointment, from the Botox appointment of the eye area. Sorry to interrupt the podcast. I am coming to you to say, if you're enjoying this, then I would really love for you to like, subscribe, follow along, and share this with anyone who might find this useful. We are investing a lot of time, energy, and resources into bringing you the best of the best in education, all about faces, bodies, aesthetics, and wellness. And I want to continue to do that, but I need you to subscribe. And if you can, if you have any questions, if you want us to address any particular topics, then please leave a comment and we will certainly create videos for you to address those. Thank you, and I hope you enjoy. Number 3, the most common mistake I see is overdoing the dose and overdoing the frequency. What do I mean by overdoing the dose? I mean using too much such that you are going for a frozen look. My friends, you are not meant to be a robot. You are meant to be able to express yourself and to tell a story just through expression. 80% of our communication is non-verbal. That means that we're telling a story by our micro expressions, by how our face looks when we are animating, and even by how our face looks when we're not animating. And so that is called expression. If you are taking or having too much botulinum toxin, that you're completely removing your ability to move in the upper face, your ability to express yourself, you start to look inauthentic, you start to look plastic fantastic. And that's not a good look. Not only because it's shiny and unnatural and inauthentic, but it's also not a good idea because it reduces your ability to connect with other people. And the reason why we do aesthetic treatments is to not just help you look good, but also help you feel good. But if we take away the ability, your ability to express yourself and communicate, then you will diminish your power to communicate in personal relationships and also in professional relationships. You're meant to be able to move your eyes and to frown and to raise your eyebrows and to smile. That is a normal micro expression. And going for plastic fantastic, frozen and unable to move looks extremely unnatural, but also diminishes your power when you're communicating with others and your ability to have powerful connections. So do not have too much of a dose. And remember, we've talked earlier about the second or the first mistake, which is having too much of a dose in the frontalis muscle in particular. Having too much is eventually going to cause thinning of the muscle. And whilst that might not be a problem in this area, so the number 11 area of the frown, having a thin muscle of the frontalis or the forehead muscle will long-term cause detriment because you will not be able to maintain the position of your brow. Now let's talk about frequency. What do I mean by overdoing it on frequency? I mean having it done too often. There's a number of different problems that can arise from having it too often or even starting too early, but that's the next problem. So when you're having it done too often, you're not giving your muscle the ability to start to build up tone again. And again, you need that muscle. But also, we know that botulinum toxin can actually cause antibodies to that toxin. So what does that mean? That means that your body can start rejecting the botulinum toxin and it stops working and you become immune to it. So if you're getting it done too frequently, you're exposing your body to regular micro volumes of botulinum toxin, and the body can start to create antibodies that fight that botulinum toxin. So much so that eventually, when you need it most, when you're in your 40s or 50s or 60s, you're starting to notice heavy lines and wrinkles that you really want to diminish and reduce, it doesn't work. So try to space out how often you are having them. I personally like to space out my own botulinum toxin appointments so they're usually twice a year. 3 times a year is fair, but having it done every 3 months, regardless of if your movement has come back or not, is really not a good idea because of the potential to increase the risk of antibodies and resistance to botulinum toxin. But also, you are not getting that muscle movement back. You're going to get really thinning muscles. You're going to start to have a shiny forehead. It's going to look unnatural and it's going to cause a problem for you long term when you need those muscles in order to keep your eyebrows in position. So really try and reduce the frequency and only have it done if you need it. I have patients who come back at the 3-month mark or the 4-month mark and they need it. Their botulinum toxin has worn off and they need it. They start to see the lines and wrinkles. And I have patients who come back at the 3 or 4 month mark and actually they don't need it and they can go 6 months without. So if you are retaining the activity of the botulinum toxin and you don't need to have it redone, don't just have it done because a certain amount of time has passed. Wait until there's actually a clinical indication to have it done. Number 4, starting too early or leaving it too late. So why does this matter? If you're starting too young, so you're having it done when actually you don't need to, that in the past was called preventative botulinum toxin, you could potentially unnecessarily weaken the muscles of your face when you don't need treatment. You could potentially alter the natural contours of your face over time. And again, you could be increasing your risk of developing antibodies to it, which will result in resistance to the botulinum toxin when you do need it. And if you leave it too late, and what do I mean by too late? I mean, I have a group, a cohort of patients who say to me, I don't want toxin because it's a toxin. I don't want to have toxin because someone on YouTube or Instagram or social media or Sheikh Google told me that Botox is bad for me. So I'm going to leave it until I'm really liney and wrinkly. That is a really bad idea. The best time to have botulinum toxin is when you start to develop dynamic lines. So these are the lines that you see on movement. If you leave it until that line shows at rest, so now the skin has undergone so much movement that the elastin and the collagen structures have been altered, and you have a line that appears even when you're not animating. You might see this line across the forehead. You might see this line in between your eyebrows. You might see lines around the eye area, lines that are embedded in the skin. It's like taking a piece of paper and folding it. When you open up that piece of paper again, that line will still remain. So when you have a line that appears at rest, so you can see it even when you're not animating, that is called a static line. And waiting until you have deep static lines is really going to be a challenge to treat. Why? Because botulinum toxin is not a treatment for lines and wrinkles that have embedded in the skin. It is a treatment that stops the contraction of the muscle, and that is it. That's what it does. It's a neuromodulator. It actually works on the nerves. It stops a signal going from the nerves to the muscle to contract. but it does not improve collagen production. It does not change or improve the actual line itself. It may do so, it may aid in softening of lines, but it cannot remove established lines. So if you've left it until you have deep lines, then my friend, that line has embedded in the skin, and you're going to have to consider adjunctive therapies or alternative therapies like microneedling or using a specific type of skincare or lasers or dermal filler to soften the line. But trying to use botulinum toxin to treat a line that has embedded in the skin, unfortunately, it is too late and it's not going to work. So remember that, and don't put off having a treatment if you start to notice that you have an early static line, so a line that you might be in your early 30s or late 20s, whatever age. It's not age dependent, but these are the times that we start to see clinical changes where lines are starting to embed in the skin. That's the time you want to get in there and do toxin. And if you get it done while you have dynamic lines that have not yet become static lines, or you get it done when you have early static lines, you are in with a fighting chance to never have that line become static, to never have that line establish in the tissues. But if you come and you already have one deep very line or two deep lines, you want to reverse that with botulinum toxin, it is not going to work. So it's very important that you understand how botulinum toxin works, the scope of it, and its limitation and its ability. Number 5, a really big mistake. Very, very problematic, very common in the United Kingdom, is unfortunately the use of cheap, fake botulinum toxin, cheap, fake Botox, and that is dangerous, exceptionally dangerous for a multitude of different reasons. Now, the rise of counterfeit Botox is a real problem in the United Kingdom. The United Kingdom does not have good regulation in the aesthetics industry. Botulinum toxin is a prescription-only drug, which means you don't buy it from a man in a van in your backyard. You have to get it from a medical prescriber after having a face-to-face consultation with the prescriber. That means that you can't buy it online. You should not be buying it online. And it's very important that the person that you're getting it from is a medically licensed professional, because it has to be prescribed to you in the same way that antibiotics are going to be prescribed to you. And you're not going to buy it from a shed or a man in a van. Why am I talking about a man in a van? This is a real problem. It's a real documented problem. It's very common in Hackney in London, very common in Liverpool, where unfortunately scrupulous injectors that are not medical are buying counterfeit Botox brought along the Sahara Desert on the black market, falling off a donkey and ending up in a man in a white van. And they come in with it in a little cardboard box or a paper bag, and they're injecting it into the face. And I often have patients say to me, hey, I can get Botox for £100 down the corner from Lily's salon. We're not going to match that. And there's a reason why we're not going to match that. It's because we can't match it when you have proper products. Unfortunately, cheap and quality don't often go hand in hand. And if you compromise on quality, you're going to compromise on results. Now, compromising on quality and results is one thing, but let's talk about the real danger of counterfeit Botox or botulinum toxin. Counterfeit botulinum toxin has not undergone appropriate testing. They are not regulated or approved, and we do not know what the constituents of them are. Botulinum toxin actually comes from a bacteria called Clostridium botulinum, and in high doses has the capacity to kill. Now, the doses that we're using in aesthetic medicine are microdoses. They're tiny, and they're not going to kill you. But in high doses, they can cause botulism, which can be a fatal issue, fatal paralysis, and is exceptionally dangerous. But what we are seeing more of is fraudulent counterfeit botulinum toxin vials that are contaminated, and they're contaminated with God knows what. They have bacteria in them, and patients are getting mycobacterial infections of every single injection site. And this is unfortunately becoming more and more common. I'm going to put a few photos that have surfaced over the course of the last year here in the United Kingdom and even abroad. And it causes permanent scarring. It can cause craters in the skin, like you can see over here. And patients are ending up hospitalized for months on end with antibiotic after antibiotic after antibiotic to try and get rid of this mycobacterium that has been injected into their tissues that causes a permanent crater and a permanent scar on their face. I cannot emphasize enough how important it is to ensure that the product you are having injected into the one face that you get in your life is safe. Do not compromise on your face. I wouldn't even compromise on my toes, and I have 10 of them. But please, this is really important. This is something that we see a heck of a lot of. Put allergic reactions to one side, which we're seeing rise more and more now. The infections and the potential long life scarring is simply not worth the compromise and the few pennies that you might think that you might save. Sometimes when you pay peanuts, you end up paying for monkeys. So I hope that helps. Those are my top 5 mistakes that I hope that you will learn from. Please avoid these mistakes. Stay safe, my friends. Happy New Year.